My name is Joel Vitali. Now, as we talk about these things, Honorable Chair, we would like amendment done to the bill, that is section 14, so that we have all these emerging products that we are talking about banned. Our position is that they be banned. Yeah, the way they have been banned in neighboring countries, and there is that complaint that Kenya is providing room for the products to be in this area, and even there is that threat of these products being manufactured in Kenya so as to pollute Africa, the entire Africa, and kill the children of Africa. That's section 14 of the bill, asking that we bring all these products together and ban them the way it is happening in other countries, even the countries where these products have been.
So that you can also have this committee, probably these countries that have been banned, maybe also tell us so that we can check whatever legislation is in place.
Yeah, they are not clear.
You can see that's why we already now start upright.
Yeah, these countries include Uganda, Rwanda, Ethiopia, and others. And even in the developed world where these products have been really in use, they are changing their mind, they are doing things differently. Go to the US, which has been cited here, go to Britain. We read these things a lot, and they are changing their minds. They have discovered that these are very bad things that are not supposed to be used by human beings, and therefore they are restricting them heavily or even banning them. Countries like New Zealand, to Netherlands, they are doing things the right way, and therefore we shouldn't allow ourselves to be the ones doing what others are discarding. We must move with the rest of the world so that we safeguard the lives of our children, because we don't have to run away from the risks of tobacco smoke just to land into the risk of vaping, that you replace one disease with another, thinking that now you are solving a problem. So research is revealing a lot more than we have had in the past, and therefore those coming with the figures, they come with the figures, but then we have got a lot and we can all have access to that information. So we would like to look at public health and reduce the disease burden that is really eating into our economy, rather than talking about short-term benefits, these some small revenues, jobs, and yet...
I want you to really concentrate. You know the way you have pointed out to us on section 14.
Yes.
We are now dealing with the specific, amendments or the things.
Yes, Honorable Chair, but it's also good to know the depth of the problem we are trying to solve, so that we don't just look at the letter and we forget about the spirit. It's good for us to. So that is what we really propose about that, and we are also asking that if it is possible, honorable members, because you are our leaders, that if it is possible, we do away with the designated smoking areas that are hazardous to our environment and the health of the people of Kenya. Those things are very bad. If we can do away with them, that will really help us. And then, honorable members, as we do this, we also look at the Tobacco Control Fund. There is a lot of money coming from the industry, and we are happy that you people are bringing in money. The problem is we don't know how much, where it is going and what it is doing. So please try to find answers to that for us, and then restructure the Tobacco Control Board so that it serves the interests of this country. Otherwise, I don't think I'll go further than that. But our prayer remains that these products be banned for the good of our children, because they attract children into addiction. The major thing is that these are traps that are being used to bring children, young people into the world of addiction. Then they even graduate into the use of hard drugs. So we should be open.